Hello students, today we will discuss a simple interrupt suture. That is a very common basic suturing method and requirement for all students, interns, postgraduate surgeons as well. So how to do that is, you need a needle holder. You have to place the needle at the proximal 2/3 distal 1/3 of the distal jaw of the needle holder. The needle should be placed at the center. Always lock the needle holder, then take the bite from the entry point from the cut edge of the wound and go to the other side, remove the needle from that side and go to the other side exit point also equidistance. Then you put the knot. So it's a simple, you are not putting the mattress suture or anything, you just put the simple suture, put the knot, usually first knot. First throw you put, tighten it, second throw if it is reef from behind, third throw from the front. So you don't put any other, just simple take entry point bite and exit point bite of the each edges of the corresponding edges of the wound, then put a knot. So it's very commonly used, but only thing is wound eversion can occur, apposition may not be adequate, but very simple, it is a quick, faster, easier to do and reasonably hemostatic also. So that is the simple, in the depth it is very easy, many places it is used, this suture is used. So we will see how it is being done, I will demonstrate that. So I will demonstrate now how to do simple interrupted suture. So already told, needle should be held like this, needle should be locked, needle should be placed proximal 2/3 distal 1/3. And always forceps use it, take bite perpendicular to the entry point of the wound, then remove it, then close it like this, come closer so that don't waste the suture material. Then second bite you take to the exit point like this, like this, like this you take and pull it out, pull it out. Now needle should come, you should place the needle in the hand, hold the needle like this and hold it like this, like this. Now pull this one. Now I will tell you, now this is the tail end or trail end, this part where knot will be placed, and this is the leading end where needle is there, needle part is suture metal is there, leading end where you make a knot, loop of the knot, that is called bait, B-A-I-T. So trailing end or tail, leading end and bait, these are the parts of suture material after placing the suture, after taking the bite through the tissues. Now once you do that, always hold the instrument, needle holder parallel like this, then do a loop like this, then hold the tail end, then pull this one to the opposite side like this. See that? Not always, it's a half knot, half throw or half knot, one throw or half knot, and knot should come on the side of the wound, not over the wound. Then second one, I am doing the reef knot from behind like this and holding in the tape and putting like this. Third one I am putting like this and holding like this and put. So minimum 3 half knots or 3 throws, then put it like this. See that? Now you look at this, it's the simple interrupted suture. See that wound is here, knot has come to the one side, knot has come to the one side. I have put reef knot. So 3 half knots or 3 throws should be there. One from front, second from behind, third from front. So that is the reef knot that I am going to explain later. So this is simple interrupted suture. Then after that, you have to cut the knot like that near the tip, hold it like this. Usually assistant should cut the knot like this. So this is simple interrupted suture. It's a basic suture actually. So students, I hope you have understood simple interrupted suture, how to place very well. Thank you very much.